Welcome to Care Coordination and Interoperable Health IT Systems, ensuring the security and privacy of information shared. This is Lecture D, Data Privacy and Meaningful Consent. This slide covers the previous objectives from Unit 10, ensuring the security and privacy of information shared. The objectives for Lecture D, Data Privacy and Meaningful Consent, are to categorize privacy concerns appropriately, modify privacy and security policies and procedures for sensitive protected health information and other special considerations, and employ appropriate tools and methods to ensure privacy and security during care coordination processes. First, we will talk about types of interoperability consents. Typically, when we are talking about interoperability, it is in the case of a health information exchange, and health information exchanges usually have two types of consent models. One is opt-in, where the default is that the protected health information cannot be shared. The patient must actively express their consent in order for the information to be shared. The other is opt-out, where the default is for protected health information to automatically be shared. Patients must actively express their desire to not have information shared if they wish to prevent sharing. These models differ from health information exchange to health information exchange and from state to state, even region to region in a given geographical area. There are even different levels of access. So, for example, different health information exchanges may allow full access or the entire record on an opt-out model, meaning that the default is for the entire health record, all of the protected health information to be shared for a health information exchange. Others may access on a limited model, meaning that only certain data elements will automatically be shared, and additional data must be actively requested before being shared. And of course, there's always the option to not share any information. Thus, this is a very complex area, and you need to understand the health information exchange that you are working with and its requirements. Additionally, more information can be found on the website on choice of consent models listed on the reference slide at the end of this lecture. Data segmentation is classifying data for privacy. It is the electronic labeling or tagging of a patient's health information so that consumers or providers can electronically share different parts, but not all, of the patient record. This can help providers understand if the information they are sharing is subject to restrictions, i.e., in the case of mental health, substance abuse, or genetic information. It can also help give patients more controlled or a detailed choice for determining which part of their health information they want shared by their health providers. Data segmentation is very important for ensuring that consumers control their data. Data segmentation for privacy, or DS4P, is a community of experts including software developers, healthcare providers, patient advocates, and health informaticists working on an implementation guide for HL7 around data segmentation. They are specifically looking at security labels for data attributes. So the first 4 security label fields are assessments based only upon the content of the resource, such as the clinical facts to which the security label is assigned. The handling caveat security label field may also convey privacy marks that are to be rendered when the labeled information is accessed. There are people actively working on coming up with a method to label the data, so everyone knows what types of privacy controls need to be applied to that data. When we look at the data segmentation tags that were covered on the previous screen, we find these are some different values for them. So, for example, the confidentiality of VIPs or very important persons at a particular institution may be very restricted. Whereas if you have an entirely anonymized, de-identified database that has been determined to be secure, the confidentiality may be unrestricted. You can see how those values for the data tags may work. Is it substance abuse? Genetic? How sensitive do we need to be to handling this data? Which parts of the privacy laws pertain to this data? You would add values from state law to that privacy law. Are you trying to compartmentalize the data, such as pharmacy or adverse event reporting? These are all things that are important to be able to track. Data tags become computable when trying to handle the data and understand the privacy and security that need to be applied to it. Again, more values for data segmentation tags. The integrity of the data, what applies to that? Whether or not you can disclose the data without consent, or you can't relink to it. How do you have to handle the data? Must you encrypt it? Is it subject to the minimum necessary requirement? And what's the purpose of this data? Is it public health? Is it operations? Is it treatment? So is it actively needed for the important purposes? And we need to let that data go through. When we talk about meaningful consent for persons, this is when the patient makes an informed decision and the choice is properly recorded and maintained. So specifically, meaningful consent has 6 aspects. The decision has to be made with full transparency about the data uses and education on their options. The patient has to have enough time to review any of the educational materials. It's not reasonable to expect them to make a decision within the next 30 seconds. Any of the purposes need to be consistent with the circumstances of why you're trying to exchange the health information. So it's perfectly reasonable under the care coordination scenario to share the information. You need it for treatment purposes. Getting consent for health information exchange cannot be used as a condition for treatment or discrimination against a person. That goes against allowing them to have responsibility for their decisions. It needs to be consistent with their expectations of what is going to or what needs to happen with their data and information. And this may differ from patient to patient. Some patients may be more reticent to share their data. Other patients will be very willing to have their data shared. And any consent to share data has to be able to be revoked at any time. There's a website in the references slide of this lecture that has more information available. So what are some tools for privacy and security and care coordination? First of all, the Office of the National Coordinator has provided an e-consent toolkit for all healthcare organizations that are seeking patient consent for the sharing of data. A link to that website is found, again, at the end of this lecture on the references slide. There are videos related to an e-consent trial project where electronic consents were pilot tested and persons chose to share their experiences with the e-consent. So you can look at what other people have learned and learn from their experiences. The Office of the National Coordinator also has modeled notices of privacy practices, both for paper records and for digital records. That's available on their website. Again, that link is at the end of this lecture on the references slide. This concludes Lecture D, Data Privacy and Meaningful Consent of Unit 10, Ensuring the Security and Privacy of Information Shared. In summary, different types of data, substance abuse, mental health, genetic, and others, may be subject to different laws and regulations, and that has to be respected in order to ensure compliance with these laws and to garner patient trust in the process. The data has to be classified and segmented, and we have to develop ways to deal with this in an automated fashion. Standards for healthcare data segmentation have been developed and are currently being implemented. Tools for ensuring the privacy and security of protected health information during care coordination processes are available on the Office of the National Coordinator website. This concludes Unit 10, Ensuring the Security and Privacy of Information Shared. To summarize, while privacy is an important social value, effectively coordinating care does require the sharing of protected health information. There is simply no other way to do it. However, to have that essential consumer trust, you must utilize appropriate technologies such as encryption and other protective technologies. Implementing data provenance and data segmentation will contribute to increased trust. Developments in this area are ongoing and will continue to evolve over time. Finally, not all data is equal, and there are now systems and tools to segment data by type or by use. It's our obligation as healthcare providers to ensure this level of trust for our clients. Thank you for your attention.